You're listening to The Social Workers on WCDB Albany.
Welcome back. You're listening to the Social Workers live radio talk show. This is your co-host, Eric Hardiman, and I'm here with my co-host, Alyssa Lotmore. Welcome back, Alyssa.
Hi, Eric.
We are excited to be here, not in the studio today, but we are outside of the studio doing a pre-recorded interview with Dr. Eunju Lee. Dr. Eunju Lee is an associate professor at the School of Social Welfare here at the University at Albany, and we are very excited to have her on the show. She's also, prior to her work as an associate professor, she was here at the university at the Center for Human Services Research, where she worked as a senior research scientist. She has been the principal investigator with a federal grant from the Children's Bureau, the U.S. Children's Bureau, and her work focuses, her research and teaching both focus on kinship care and child welfare. So we're very excited to have a faculty member and talk about your research, and we welcome you to the show, Eunju.
Thank you. Well, first, thank you for inviting me to talk about my research and share my ideas. Mm-hmm.
So let's just start off right away. And what led you to enter the field of social work?
Well, actually, that's going to be a really long story, but I'll make it short that since, my college years, I've been always committed to social justice, and I worked as a student activist in college, and during those summer and winter vacation, the vacation months, we used to go to the urban slums to provide the child free daycare, and then went to, the very impoverished farm. Then we worked as, childcare workers. Mostly people are working at the farm during summer. So that was a sort of how I started. But I could have gone to social work, but my father didn't let me actually do any kind of a social science work because I had to choose a foreign language to stay in university because politically it was very volatile. It was very worried. Then since I came to United States after college, I was involved mostly in small groups, doing little activism or gender violence, so sexual violence against women and gender equity. So that was how I do not have a degree in social work, in like a master in social work, many faculty do, but I always think myself as a social work at heart.
An honorary social work, and
Yes.
certainly because you teach in the School of Social Welfare, that gives you that expertise. Yeah. So tell us a little bit, so you talked a bit about your journey from South Korea here to the U.S. Maybe a little bit about what got you into the academy. How did you decide to be a researcher and sort of question these things from a research perspective and then to get into higher education?
So I actually didn't intend to get a PhD degree either. So I always consider myself accidental PhD. But I was very interested in always socially disadvantaged children and mothers. My background, my just volunteer work. So I was offered the scholarship to start in a graduate program in the sociology. And so I was really interested learning more about what contributes social inequality in the United States and in the world. So, and that's how we really sort of become a research on children and families. And then I got the job in a Center for Human Service Research, and I was really digging into the child welfare research. And this is how then when opportunity came, I transitioned into the tenure faculty. And, probably big motivation was to really dig deeper into child welfare research. So
it sounds like your journey has been shaped by an interest in these topics, but also an interest to really explore them from a research perspective and to dig deeper about what constitutes these issues.
Yeah, and I have to say that what really excites me about doing social work research is its emphasis on implication. So what question? So when you do a lot of evaluation work, we do ask them. We try to our mission is sort of like try to help the program improve. So, but when you do research in child welfare, I really do think about how can I make my research findings influence or at least shaped child welfare policy and practice, and that's what excites me. So.
Well, it seems like you're interested in you have a lot of different interest areas, and I know one is kinship care, which has always been, when I was an undergrad student, my first internship was doing work with kinship care programs. So can you tell us a little bit about what your areas of interest are?
Well, kinship care, of course, has been with us forever. We always joke about that, but my interest is really relationship with kinship care. I mean, sort of like an intersection between kinship care and child welfare. So, particularly in informal kinship care, and that's a sort of a term that people are not really familiar with. Mostly people are very, intuitively know what kinship care is, but informal kinship care is that when children no longer can safely stay in their biological home, they child welfare services and decide to remove them from the home, right? And then there are sort of children can go to foster care, openly involved in non-relative foster care homes, or go to the kinship foster care. They are the grandparents or relatives who are become a foster care parents. But research, although very limited research there, we actually believe that large number of children who remove their home voluntarily goes into grandparents without a lot of support from child welfare services. Okay. So they constitute this informal kinship care, meaning that they are not in kinship foster care, they are not in the foster care system, but they have there are a lot of child welfare involvement.
And so I guess the implication then is that the grandparents or the caregivers, whoever they might be, are providing that care, but without formal supports from the social service system.
Yeah, so we call it diversion, which means that they're diverting from a former foster care system, because foster care, despite all the problems of foster care we have, it just provides a sort of structured services and payment. But a lot of local counties do not want to have that kind of burden. Also, they don't want to increase the number of kids in the foster care system. If your children go live with your aunt or grandparents informally, after child welfare investigation, child welfare services do not have a legal obligation to really follow children through the system, or really have to put an effort to reunify them with their biological parents. They don't have to follow those mandates. So this sort of a diversion happens a lot, even though we don't have an official record, so it's very hard to follow. So when I become a assistant professor, I was lucky enough to get Children's Bureau grant with a community organization providing services to those informal kinship caregivers. And so we set out to do really a lot of research on those population. It was hard to identify. We, look for the people who are not in foster care system, grandparents or relatives, but they are caring children on their own 24 hours. And we did find it, and I did about and I couldn't really prove them. Actually, there are many cases their children has been heavily involved in child welfare services.
Interesting.
And there's some cases they are now not in foster care, but we actually just did a paper and submitted with my doctoral students. There's some cases that kids has been there are 10 child welfare investigation so before they move in with the kinship caregivers.
So they've gone from case to case to case, and this is sort of a multi-involved family unit.
They've been over a number of years. There'll be number of child protective service calls, and sometimes kids go into the former foster care with a non-relative foster care. Then they move out of that, and they're reunified with parents shortly. Then there are another phone calls, investigation and or allegation of child maltreatment. Then child welfare step in, and sometimes then grandparents comes in. I'm going to take care of the children. So that happens.
So if you've just tuned in, we're listening to an interview. We're talking with Dr. Eunju Lee, who's an associate professor at the UAlbany School of Social Welfare and who specializes in kinship care and child welfare research. Could you tell us a little bit, Eunju, about how maybe you've seen the ideas of kinship care and child welfare change in the last 20 to 30 years? Have there been significant changes in those areas?
Well, yes, there has been actually significant changes probably last 20 years. In old days, kinship care, we actually did not consider grandparents as foster care parents. You know, it was just two parallel system. There are foster care system, and then there is a kinship care. Then there are a lot of effort before me. Effort to really, just recognize grandparents and other relatives as a really best alternative. Out of home care provider. So gradually kinship care kin caregivers become a foster care parents. But probably most significant change is there is a law called the Fostering Connection Act in 2008, and that was sort of really make sure that before we remove the children from their home, we have to notify kin. Okay. And they are really pushing very hard to actually kin should be the first choice to take the children in. So that was probably, and so there are kinship care has been increasing, and I also have to say, and unfortunately because of opioid addiction, and then there are more reliance on the grandparents and then other relative caregivers. But my research shows that at least it's not, I have to say, it's not really population-based, but it shows that about 70% of kinship caregivers are grandparents. Okay. So they are pretty quite old and pretty poor. And then about 30% of the other relatives, so sometimes older siblings, step-siblings, and aunt and uncles, they are big.
Well, before we jump into a lot of the contributions you've making in the field, I have a question about your new publication. So you recently have a new publication in the Journal of Child Abuse and Neglect titled Reducing Maltreatment Reoccurrence Through Home Visitation, a Promising Intervention for Child Welfare Involved Families. So why is this paper important to the child welfare system?
Well, this another area I've been really working for many years is sort of home visitation, early home visitation. And early home visitation have a lot of different models, but New York State has this program called Healthy Families New York, which is considered by federal government as evidence-based model. And I've been doing randomized control trial, which means that we use these two different groups. One is the home visited group, and the other one is control group, really following them over time, and then see that whether there is a program impact. And my early, during my, career, I wrote out a very early findings, and so this paper is really talking about what happens year 7. Year 7, we found that the mothers who actually been involved in child welfare services prior to they receiving home visiting services actually have a better outcome in terms of child maltreatment. And as many people know, preventing child maltreatment is pretty hard, and there's a limited, evidence-based models. And home visiting, there's a lot of debate on home visiting, whether it's actually really effective in preventing child maltreatment. So this paper just indicating that if people are exposed early home visitation services starting either pregnancy when baby is just born, you could really prevent recurrent child maltreatment. So this particular group of mothers all had at least one substantiated child welfare record. in New York State. So then they received the child home visiting services when the second child was born. So
you describe this as a promising intervention.
Yes.
So for an audience, sometimes our listenership is maybe not all social workers, maybe folks in the community who don't understand or are not conversant in the same policy arena that sometimes we talk in. If you were to describe this intervention, what is the home visitation? What does it look like to someone who's not familiar with that model?
Well, home visitation model goes back to early 70s and actually started mostly in England. But I have to say, as a social worker or social welfare researcher, the foundation of a social work really goes back to the home visitors, So when we actually studied the social work as a profession, people often went to their home to look at really make sure that children are well fed, and then mothers, often having enough necessity. There was a sort of a foundation of what the home visitation is, and so modern home visitation, that's really history, but modern home visitation is that you can use different professionals. One group use this nurse family partnership, use the nurse program, so they go to they identify eligible participants during a pregnancy, and mostly socially disadvantaged mothers, either they are very young or do not really exposed to any kind of intervention services, and also we know they have a multiple risk for adverse outcome, adverse birth outcome and adverse child health outcome, including maltreatment outcomes. Okay. So when the potential expectant and new mothers identified, then home visitors with a similar background, sometimes similar, from the probably similar cultural background, and go in to their home, provide services, in-home services. Basically, they are supervised by probably MSWs, but it's, although some programs are not requiring, but home visitors are the one who going in there, talking with the mothers, expectant and new mothers, about what to really expect in childbirth, what is the best nutrition, or maybe help them to stop smoking, and then, curb drinking, or addressing their any kind of other stressors during pregnancy. Then when the baby is born, and they also link to a lot of services, they link to, for example, people are familiar with a WIC program, Women, Infant, Children Nutrition Program. So home visitors will say, do you have a WIC? If they don't have a WIC, and they said, let me just link to the WIC services. So they do that kind of work. And also they said, that's, child going to have pediatricians when the child is born. So those kind of services really is what I consider is fundamental social work they do at the in the field. Then when the baby is born, then their focus is about attached parenting style. It's really based on the parents and children, the babies, need to be really nourished together and supported by the home visitors. So they going to, probably either bi-weekly or monthly, visiting the families, and then talk about any stress of raising kids. You know how it is and having young babies, and then they show them how to bath, how to nurse, how to really, change clothes, or address any kind of a colicky babies. Those things they do, and also talk about when their children's really older, then they start talking about what are the really good way of I would say, or stay away from harsh parenting. So they really teach about warm parenting. So one of the things we give out to as a sort of a gift in the program is the baby vision. You remember that you carry baby in the So actually some programs give out that as a sort of a gift. As a encouraging them to, instead of having baby in the carriage all the time, carry the baby, next to your heart. Just those kind of things we encourage them. So and then usually the program go until children are ready to enter maybe early Head Start, or Head Start. So
So maybe could you tell us a little bit about how your research influences your teaching? You're working with social work students here at the University at Albany. How do you bring your research into the classroom?
Well, I've been lucky to teach this course is really directly related to my research, and I teach program evaluation and social work management, and then I love that class, and students really bring their field experience, and they actually talk about we develop logic model, what programs supposed to do, to all the way to what are the really they can measure an outcome. So we do work really together. But my experience working in the lot of in long time in program evaluation helped them to really see that how sometimes we all have a good intention. program has really always grandiose goals. One of the things I tell my students, we have to be a critical thinker. That's our job, especially my course in evaluation. You have to think about that. Sometimes because you have this intention, you want to do that, it does not really always translate it into the program that you want to see, or it's not really implemented very as we plan to. So that was evaluation courses I teach, and then I, like I said, I'm very lucky. I teach child welfare policy. That's directly in my, in my work, and then I love to talk about, what really we can make differences, and I use my experience. For example, I actually met with a number of center staff, members who, educating informal kinship care. And I remember these lawyers who really highly educated, Senator Gillibrand's and Schumer's staff, senior staff, asking, I never heard about kinship care, So it was just, I was talking about, those experience, and I did also, hearing at the legislative hearing. So in that way, the students can really not just think as another paper, but really what they can really make a differences. So the child welfare policy, usually it's like a last semester for our MSW students. So I always tease them, you're done enough of writing papers, 25-page papers. So you're not going to do that this class, because I really want you to thinking about making differences. So we, one of our assignment is like the advocacy letter. Students are given maximum liberty to choose topic they like, instead of I tell them write it. So, but it has to be child welfare related. So then they can write a letter, or they can advocate either passage of a bill, or really about maybe more fundings, or recognizing, there's an issue. So, one of the most popular topics the students often work on is that providing support for the kids in the foster care system, or really make sure that they get a lot of good education while they're in the foster care system, which is actually part of also 2008 Fostering Connection Act. So they can match what their passion, students often just have their area they're interested in, population, and then they have to find some kind of connection with the legislation or policy. So they do, writing pretty, sophisticated letter to the either somebody who's going to be in power to change policy. So.
Well, that's an important part of social work, is learning how to do those things. It's not just maybe the clinical work if they're interested in, or it's not just work in your office. It's how do we connect with lawmakers who can make change at the policy level to help the individuals we're working at, or the programs that we're working with. So as we wrap up, I guess we want to know is, what are you currently working on? What's next for you?
Probably to continue work on kinship and home visiting. Home visiting, our randomized control trial, it's been sort of winding down. But I just received a huge data set It's called, it's a big data set from Cornell. And I'm hoping to work on those data set, continuing my research in child welfare with a couple of doctoral students. So, and that data set is, it's really sample of children who has been investigated by child welfare services, but it's a population-based sample. It's a huge data, and it has a 3-wave, meaning that they followed 3 times already. So, we can really follow. For example, my research question could be, is there really transition between between like home to informal kinship care to formal foster care, and over 3-year period after the initial child welfare investigation. So I could explore that with a, population-based sample. That's exciting. So.
Yeah. So it sounds to me, this is really exciting to hear about your work, Eunju, that you are working at the intersections of policy, practice, research, and teaching, and that you're really doing a tremendous service not just to the knowledge base that's out there and to society, but also to our students here at the university, and showing them how to connect ideas of research and evaluation to social work practice and social work policy. And it's really nice to see someone connecting those threads together in those ways.
Oh, I'm not sure I'm doing a superb job yet, but I'm really working on it, trying to make it better and then make it more interesting to my students. And I always try to improve my teaching, through that. So
we've been talking with Dr. Eunju Lee, who is an associate professor at the School of Social Welfare here at the University at Albany. This is the Social Workers live radio talk show. I'm Eric Hardiman, and I'm here with Alyssa Lottmore.
And this was a great segment. So this is something, one of the points of our show is to reach individuals who might never have considered seeing or using a social worker, or who are not familiar with things like kinship care and other types of things that social workers do. We do a lot, and we're involved in a lot. And this is one way to share that with the public. So I thank you so much for being on and sharing your expertise and all the work that you've been doing.
Thanks for being our guest.
Okay, thank you for having me.
We look forward to hearing about the ongoing impact of your work.
Thank you. I will try.
You're listening to The Social Workers on WCDB Albany.